16, baby. So, you have a patient and they have an absent knee-jerk reflex and groin pain. What nerve is most likely injured? The femoral nerve, right? If you have a patient that gets multiple blood transfusions, that can lead to what? The production of alloantibodies. So watch out for those alloantibodies. Is it ethical to date a patient? Nope, it is not. It's not ethical to date the mother of your pediatric patient either. If you have a concern for acute pancreatitis in a patient, you should start by doing biochemical testing. Look for the amylase and lipase, by the way. Note, lipase or amylase greater than what indicates acute pancreatitis? 3 times, right? And if you see it, you want to check the lipids. If a patient has acute pancreatitis, 1 to 3 days later they have fever, leukocytes, and abdominal pain, what sort of imaging do you want to do? Imaging of the abdomen with a CT. Look for a cyst or something like that. Alright, so regarding the treatment of C. difficile, 1, you have vancomycin or fidaxomicin. On the second time, still have vancomycin and fidaxomicin. If the third time happens, or recurrence, that's fulminant, treat that with metronidazole and vancomycin. And you might need to do surgery. True or false? Advanced directives outweigh power of attorney and next of kin. That is definitely true. Note to self, get advanced directives. You know I'm sizzling? I gotta think about the future here. My future death. I'm dead right now. Power is the ability to do what regarding a study? To detect difference in outcome between 2 groups. A heart border with spotty calcifications leads to concern for post-constrictive pericarditis. Is that true or false? That's true. The first step to evaluating hypothyroidism is to do what? Is to measure TSH, the T3 and T4, free TSH, T3 and T4. Regarding the patient, if you want to do a sex history on them, you need to ask them what? Can you tell me more about your sex life, right? If you have a concern for vaginal atrophy in a postmenopausal woman with vaginal dryness and dyspareunia, is that a good concern to have? Yep, because vaginal atrophy is common. If you have concern for traumatic injury in the ER, what sort of scan should you do? Focused assessment with sonography and trauma, also known as a FAST scan. If your patient has a scaphoid fracture, what bone's most likely injured? The carpal bone. Does a scaphoid fracture require wrist splinting? Yeah, it does. Inadequate management of non-displaced scaphoid fracture can lead to what? Non-union. How do you treat latent TB? Isoniazid for about 9 months. True or false? Systemic templates and checklists improve patient handoffs. That's definitely true. Clindamycin and gentamicin treat postpartum endometriosis. True or false? It's true. What's the most important risk factor for postpartum infection? It's the route of delivery. If you suspect renal colic during pregnancy, what should you get? Get a renal and pelvic ultrasound. A patient with a PE or DVT needs what sort of interventions? Heparin or low molecular weight heparin warfarin, and an IVC filter in complication to or contraindication to anticoagulation. What does a patient with septic joint concerns need? And arthrocentesis. How do you treat pediatric septic arthritis? IV vancomycin, right? What can help treat multifocal atrial tachycardia? Ventilation. Persistent multifocal atrial tachycardia leads to electrolyte disturbances, which needs to check for what? Potassium, and replace the potassium if needed. A patient with reactive arthritis may take 1 to 4 weeks to develop, so you may need to repeat a urinary nucleic acid amplification test for chlamydia trachomatis. For 29, treat reactive arthritis with what? Naproxen and antibiotics. What would you see with classic gout? Negatively birefringent needle-shaped crystals. Acute monoarticular gout can be managed with what? Intra-articular glucocorticoids. So if a patient's trying to give you a glyph, you can decline the glyph but still give good patient care. Beware with those gifts. If they're pricey, don't take them. If they're cheap, fine, take it. If they offer you like opportunity to come to their wedding or some big event, accept it. Regarding sudden hearing loss, what sort of things should you check for? Centenarial, conductive, and urgent to ENT. Refer to ENT, right? If your patient has multiple fractures, you should be concerned for multiple long bone fractures. You should be aware of what? Fat embolisms. So early immobilization and operative correction of the fracture is important. If your patient has blunt truss trauma, e.g. NVA or seat belt with a steering wheel, that can cause pulmonary contusions, right? Right. How do you best manage a pulmonary contusion? Pain control. If you have a patient with scrotal trauma, what imaging should you do? An ultrasound. Are cherry angiomas malignant? No, they are definitely not. Cherry angiomas are benign. What should you be concerned for? You have a patient with a family history of late bloomers. This patient has delayed puberty, is short, but has a normal growth velocity and delayed bone growth. You should be concerned for constitutional delay of growth. And if you have a patient who's accompanied by people in the same room while you're doing interview and you're asking them things, and it seems like there's some undertone that the person with them might be causing them harm, or you want more info from just the patient, what should you do? Speak to them alone, right? Say, I would like to speak to you in private to discuss your feelings in more detail. That would be key. That would be clutch.